Mental Health Monday
on Radio City Talk
with Mick Coyle.
Tackling the stigma.
Radio City Talk.
Mental Health Extra for a Tuesday. Jake Mills is in the studio. He just noticed that I started speaking too quickly.
You just forgot about a little bit, didn't you?
I was champing at the bit there. Welcome to the studio, Jake. Great to see you.
Thank you. Good to see you.
We are speaking today on the day that James's Place is officially launched in Liverpool. It's setting itself up in the Georgian quarter, and it's going to be, what people say, for men with mental health issues. It's more specific than that, isn't it? It's about suicide prevention and men who are seriously at risk of suicide. I wondered when I was speaking to the team setting up, Claire and Nick, who lost their son James to suicide, I wondered throughout that conversation what you would have made of that, Jake, in terms of that as a place to go to and to be referred to when you are in that darkest of dark moments, something which you yourself have been in terms of your own experience when it comes to mental health. Yeah,
I think it's much needed. I think you made the point, Mick, about people who have gone through situations having to be the ones who are actually saying, well, let's do something about it, let's change it. Unfortunately, it shouldn't be that way, but Claire and Nick are examples of what you can do to turn that horrible experience round into something positive. They've put so much work into this, speaking to people, finding out exactly how it can work, what will work best, how it should be, working with universities, working with hospitals, with A&E, to make sure that it is actually going to be valuable and work, and it absolutely will. It absolutely will. It's for those people in crisis who we know aren't going to get what they need out of A&E. So yeah, it's a monumental day, really, actually, for that, and it's hopefully, as Nick said in the podcast, going to be the first of many James Places.
Yeah, absolutely. It's here in Liverpool as well. You played your own part in sort of making this happen, because there's a kind of a network of people who made this whole thing happen. Jane Boland joins us for the programme as well. You did your own bit as well. Yeah,
I first went to a steering group, which was. It was 2.5 years ago. In fact, I can tell you the exact date. It was the 19th of January 2016, and I can tell you that date because it was the first time I'd ventured out after my son was born. So I remember it was my first meeting. I remember being like, "What? People are talking. I haven't got a clue what's going on." But the reason why I do remember that is because it was the first time that I'd kind of gone back to work, and I was hearing Claire speak about James, and for me as a brand new dad as well, it was really it stuck with me, and from then I've kind of helped work closely with Claire and the team, and we were able to meet with the mayor, Joe Anderson, who was really kind of massively supportive behind this, and he kind of gave it his full support, and worked on getting the building, which they did in Catherine Street. So I've been really proud to be part of it, really. I remember walking around looking at all the different venues with Claire, and we weren't really set on one, but when Catherine Street came along, they absolutely just fell in love with it straight away. And again, Nick was talking about how it's designed to be in a certain way, and we had a bit of a focus group with men, and it's a hard balance, really, because what they've come up with is fantastic, but even in that focus group, people are coming up with so many different things. So we just had a group of men together to say, what would you like it to be? And
I mean, tell me about that, because good design is good design, and there's a danger sometimes you go, well, let's have a picture of a Ferrari on the wall, let's have some football posters and a rug with a little train set on it or something like that. Make it for boys.
It wasn't far off that, to be honest. But as an example, we were saying, what would you like it to be? I think overwhelmingly people were saying they want it to be somewhere welcoming. They want it to be somewhere we can just have a cup of tea. People talking about a fire. People we talked about the colours and stuff. But again, you got like a total mix in that you got somebody who said, I'd love to go in as a telly with Sky Sports News on. And then someone else said, that would literally be my worst nightmare. That's the opposite of what I would like. So it's hard, really, to get that. But I think what has been created is welcoming, it's relaxing, it's comforting. It's the opposite of the clinical, that's the purpose. And I think that's what we kind of got out of the meeting, I would say. And then, that was the meeting, and then they've put it into actual reality. So it's amazing to see, but it's going to be so important.
I wonder whether or not sometimes when I talk about Liverpool doing things ahead of other places, Liverpool, foreseeing issues, doing something about something, I wonder whether or not just because I'm seeing it from a Liverpool point of view. But actually, in that conversation yesterday, that was people who aren't from Liverpool actually saying, no, Liverpool is doing this right. Liverpool was the appropriate place to come to. As soon as we spoke to the right people and we saw those opportunities, we realised that Liverpool was the right place to be.
Yeah, and I think, again, it was stated yesterday that Liverpool was not their first choice when coming into this. And I think at one point it was between Liverpool and somewhere else. I think maybe Durham or somewhere. And again, I think, without speaking on their behalf, one of the reasons why they did go with Liverpool is because Liverpool wanted this. We wanted this. As I said, the mayor wanted it. He said, do everything that we can to get it. Merseycare wanted it. They said, I think they just bought into it. The universities, Liverpool University, were really good in kind of collecting people together and that kind of network of people. We just wanted it and we want to make it work. And I think that's what something that they bought into was that, you know what it's like yourself, but if you don't have to sell the idea, that makes it so much easier when people are saying you don't have to sell this idea to us. We get it. We understand it.
Episode 69 of Mental Health Monday available to download as a podcast. Just go to your regular podcast provider or just go to our social media and you can find a link, hashtag Mental Health Monday for that one, and you can listen to episode 69, James's Place. Prince William was there. He's the Duke of Cambridge, right? The Duke of... He's
going to be the king, and that's the thing that you need to... That's all that matters. The future king was there.
Puts me in mind of that song from The Lion King. Do you reckon he ever just finds himself whistling?
Have you just compared him to Simba?
In many ways. In many ways, you just can't wait to be king. I don't know, maybe he doesn't. But Prince William opened it as well, the sort of the royal seal of approval, if you like. The royal family don't really speak out on any issues at all. And arguably, they don't say anything. Like, what are their opinions on Brexit and all that? You never hear any of that. But actually now, directly with the royal family, you hear about mental health. You hear that regularly from them as well. It's a passion project for them coming from Kensington Palace as well. People talk about Diana as well. She was slightly then removed from the royal family because of the nature of the marriage and so on and so forth, the work she did on AIDS, landmines and so on and so forth. But there's something in that, isn't there? The royal family talking about an issue, not talking about hardly anything else, but actually choosing to talk about this. Yeah,
and as you said, it's regularly as well. They're not sound bites. It's not just a kind of a trendy topic. They are serious about it, and to get that endorsement for James's Place to open it is significant. I would say, particularly moving forward, looking at future plans for other places, and also to help with government and NHS and all that. The power of it is amazing, really. So fair play to them for everything that they are doing.
Jake Mills is with us for Mental Health Extra. My name's Mick Coyle. It's Radio City Talk. Just reading the Star today, 20 men have taken their own lives at the same jail in 7 years. The reason this stood out, Jane Boland yesterday was talking about working with people, the right type of people at James's Place, somebody coming across from one of the prison services. Inspectors expressed concern about chronic and substantial staff shortages at the prison. This is HMP Woodhill in Milton Keynes. It was a huge concern, said Peter Clark, the Chief Inspector of Prisons. After the latest inspection, Mr. Clark described the number of prisoners taking their own lives since there as staggering. It's an incredible number of people. 20 men have taken their own lives at the same jail in just 7 years. There's a danger with this one where people go, it's prisoners, we expect them to be in squalid conditions. But I don't think at any point we considered that to be part of the punishment. It's something which the prison system has got to get to grips with, because it's an ongoing issue and an issue which keeps coming round again.
Yeah, and it's up and down the country. I wouldn't particularly say that it's something that people talk about generally for that reason. Prisoners are just criminals and we forget about them type of approach to it. But it's a serious issue, and particularly not even just within the prisons themselves, but also as part of that probation as well. When people are coming out of prison, then very, very major lack of support there for people coming out and within this. And to be fair, I think prisons are acknowledging it and looking at ways how to do it, how to kind of address that. It's difficult because if you were talking to me about somebody you're worried about, I would direct them to all these different services that they can go to within prison. And what do you do? So it does come down to funding for people to be in there and the actual services within the prisons themselves. But it's something, again, that's going to have to go to the highest level. And these are lives at the end of the day, and these are people.
Yeah, I mean, and this is the thing. I mean, people sometimes think, well, they're prisoners, who cares? But then we have a responsibility, a contract with these individuals. They are there to be punished, but they're also there to be brought back into the community. That's part of the probation service, is part of the contract, if you like, that you enter into as part of the justice system. Presumably that's got to include mental health, because actually the attitude and the way that somebody sort of thinks about themselves coming out of prison, when they get an opportunity to just go back to their old ways, presumably has a huge impact on their ability to either change their life or slip straight back into it. There's a mental issue there which presumably needs to be taken into account. Yeah,
and that's the entire point of a prison, is that you're there to not only, as you say, not to be punished or only to be punished, but to learn and to be able to go back into society and change who you are as a person. But if you're just going back out and you're committing the same crimes, you're going back in and out of prison constantly, then that has an impact on us all as a society. So it does need a drastic change, and hopefully something that people will take a lot more serious now. And there's a lot of reasons why someone might be in there, and we can't kind of tar everybody with the same brush as well. So yeah, it needs something drastic to change there.
As Jane was talking about yesterday, when she was talking about why we should intervene when suicide becomes an issue, she was using it as an example of somebody who goes to university, somebody who might be spending £9,000 a year but feels the need to drop out because they're in a particularly dark place when it comes to their own mental health. Jane saying, if you can make that intervention, then you can keep them within university. They don't have to drop out. They don't then have to saddle themselves with extra years worth of debt. They then don't go into the system, which then requires the system to pick up the tab of the associated costs with treatment. Early intervention is absolutely key and crucial in all of this as well. I thought about that, and I was thinking about that, but I was trying to place that early intervention thing alongside the issue of the fact that it's a sort of immediate suicide risk centre, because presumably early intervention, it's not early intervention, is it? It's sort of like immediate management required. It must be quite intense, the work they want to get into at James's place to try and turn around a situation, as Jane set out yesterday.
Yeah, it is. It is a crisis centre, and that's going to be so difficult for anybody to deal with it. But I do think I'm so glad that Jane is going to be the one who's going to be leading that. But it is about it. It's about James's place is not being needed. It's about one day nobody ever walked through there, because no one's at that crisis point. Of course, that's what the aim and the goal is, but they're dealing with the reality as well. But early intervention and prevention is absolutely essential. The kind of the waiting lists and the kind of things that you've got to be able to do to get into NHS services is so high that early intervention is going to be almost impossible when you can't even get in to see anyone. If the strain that the NHS is under, if you can get into somebody earlier to get that prevention, to get that intervention, so that they don't have to go to NHS, they don't have to rely on that, they don't have to be on waiting lists, or they don't get to the crisis point, then that's gonna be beneficial to everyone. And for me anyway, the biggest way that you can do that is by educating people and by getting it into schools.
Yeah, we were absolutely making the point as well yesterday. This isn't an opposition to the NHS services as well. In fact, the guys were in full praise of the NHS services. This is something else as well. Something else. It's coming from a slightly different point of view, but actually this is going to be complementary to the NHS services already existing.
Absolutely, and that's why they have been working hand in hand with the NHS as well. It's about saying to the NHS, we'll take the people and help them, because you're under enough strain and pressure that we know that that's not the place for them at that moment when they're in that crisis point. So it's hand in hand, and it's a fantastic model, and I've got absolutely no doubt at all that it will save many lives.
Jamesplace.org.uk if you want to find out more about the work that's going on there. Thanks to Claire Milford Haven and Nick Wentworth Stanley, who joined us for Mental Health Monday yesterday, Jane Boland as well, making me probably the second person who works in mental health from Chorley. She's from Chorley.
Well,
she's clearly more prominent than me. She does much more important work than me.
Yeah. So it's just you two, is it?
In terms of, I think in Liverpool, if there's anyone else working in mental health from Chorley, but based in Liverpool, I don't know.
Well, put out this is the opportunity you've got. We can turn it into the Chorley hour.
It would be great to be not in the top 10.
It could be mental health Chorley. That's what it can be. This section every Tuesday.
You mentioned Chorley last week. I'm just throwing it in there this week. Jake, you're always out and about. You're always speaking to different people. What are you up to this week?
Oh yeah, do you know what? I've had a long weekend with a Father's Day and a wife's birthday that I'm just so tired. So tired, but no, we're getting the word out about the Hub of Hope to make people know that there's help available. We're working with local and national organisations, including the National Suicide Prevention Alliance, who have just added us as part of their alliance this week. We're just trying to get that message out there that there's help and support available.
There's a new website as well for Chasing the Stigma, which is now up and running.
It is chastingstigma.co.uk. We're also going to be doing a mud run soon, which we need sponsors for, because that basically, as a charity, we exist almost entirely on public donations. So any help and support we can get towards that will help us continuing to show people the support available.
Chasingthestigma.co.uk and the Hub of Hope, which you mentioned there, hubofhope.co.uk. Type in your postcode or just type in your location thing on your phone. It'll find mental health services near where you live. Jake, thank you for your time. Great to see you.
And you, thank you.
238 Mental Health Extra. If you subscribe to this, by the way, via podcast, it will automatically appear into your podcast feed. If you want to do that, you can subscribe via our Audio Boom page as well. We'll get all the details up on our social media. We are #Mental Health Monday.
Mental Health Monday with Mick Coyle.
Radio City Talk.